me today, we have Dr. Heather Keefe. She is a lecturer in Regent University's School of Psychology and Counseling. She holds a master's degree in experimental psychology from Old Dominion University and has worked in behavioral health research at Eastern Virginia Medical School for several years prior, utilizing her research skills in support of the military. She earned her doctorate in clinical psychology from Regent University and completed her internship with the Sheridan, Wyoming Veterans Affairs Healthcare System. Her clinical and research interests center on intersectionality and identity work, specifically within the LGBTQ population, as well as adult, military, and veteran polytrauma and polysubstance use. In addition, her clinical practice includes treatment of mood disorders, serious mental illness, and personality disorders. She has a passion for working with community partners to encourage clinical best practices that promote inclusivity and advocacy. Dr. Keefe, thank you so much for joining me today.
Oh, thanks so much for inviting me to this. It's good to see you.
Yeah. So I've been starting these kind of interviewing some of the Regent faculty, and one of the first things I ask is just where did your general interest in psychology begin, and can you tell us a little bit about that?
Such an interesting question, right? So, I'm not really sure. I know that in high school, so this is like 100 years ago,
Uh-huh.
but in high school, they actually offered a psychology class, and it was for the upperclassmen to take. And I know that I somehow finagled my way into that class as like a sophomore. I like schmoozed somebody, was like, I'm gonna be great. So they let me take that class, and then I started college, and I actually was pre-med when I started college. I wanted to be a biochemist,
Oh.
and realized very quickly that I hated chemistry. And I said, you know what, I really enjoy my psych classes. I've always enjoyed people and patterns and understanding, or seeking understanding into humans. And so that's really where it was. And I left, majored in psychology as an undergrad and minored in sociology, and then pursued my master's shortly after that.
Hmm.
But yeah, that's really where it started, I would say. Super early. Don't know why.
Yeah, no, that's cool. I'm fascinated every time. I never had any psychology classes in high school, and I don't know a lot of people who did in my area. So that's really neat that a lot of high schools are offering that.
Yeah, it was
Yeah.
pretty cool.
And then so what went into your decision to pursue a master's?
So, well, I realized as an undergraduate that I didn't have a lot of guidance in what it
Mm.
would like. I knew I was interested in this topic. I knew that I was in college. I knew that I want to be educated. I knew I wanted to do these types of things, but it wasn't really until like my senior year or my junior or senior year in undergrad when I realized, oh, in order for me to do the work that I want to do, it requires a graduate degree. And then what is a graduate degree, right? Like, what does that even mean? And then all the different facets of psychology and science within that. And so I did some exploring. I was able to, I just think it was very fortuitous, right? Divinely, opportunities were just coming for me to talk with some wonderful mentors who took the opportunity to explain graduate school to me, to explain how the field works beyond, kind of getting your undergraduate degree.
Uh-huh.
And it was in that time that I was like, oh, okay. I also was doing an external practicum at EVMS at the time, doing some like research assistant work. And so they offered me a position to work after my undergrad degree. I stayed there for a couple of years and then realized quickly that I wanted some more independence and autonomy in the work that I was doing.
Hmm.
And the master's degree in experimental psychology really aligned with my interests at the time. It still does. And so I went back and got my master's, finished that pretty quickly, and then went back to EVMS actually to work as a research associate at the time. So it was
Okay,
great.
cool. Yeah.
Yeah.
And that's another fascinating thing is that so you were able to, with your bachelor's, work at EVMS for a while, for you said a couple of years?
Yeah, it was about 2
Yeah,
years, year
good.
and a half or so.
And then I'm not really familiar with experimental psychology. Can you explain that to me?
Sure. So it's really, the science of what we do.
Okay.
And so a lot of my coursework was statistics. I actually took 2 stats classes in my undergraduate degree.
Wow.
I was double majoring at the time. So I double majored in psychology and sociology for a while, and then realized I wanted to pursue my graduate work in psychology. And so I dropped the sociology degree down to a minor. But in both of those tracks, they required different types of stats classes. And so it was just a really good math fit for me. My brain, somehow wraps around that pretty easily. And I understand scientific design. That's just how like my brain organizes information anyway. And so when I was looking at options for kind of next steps, I knew that I loved research. I loved gathering data, creating and publishing like what is knowable essentially, and the responsibility that comes with that. And so I loved the option to be here and to do, I point this way because that's where ODU is, to be right down the street, and to do more of that work and to refine my skills as a scientist. And so I learned a lot more about stats, the research design, did a whole thesis study, independent kind of research study there, which was super interesting. And ultimately, like, it is why when I talk with people now, I don't know if people know this about me, but I identify first as a scientist, also as a practitioner, but I identify first as a scientist. And that's really just kind of how I think about the world. But I also love the idea of putting what's knowable into practice, right? So after a while, and this isn't the question that you asked me, but after a while in working in research, I really yearned to be able to do the thing. So I loved kind of creating knowledge and discovering the world, but then wanting to put it into practice was kind of felt like it was left out. Hence why I sought a clinical degree.
Yeah, and I was thinking while you're so data driven and research oriented, did you consider PhD programs, or was your kind of drive to now put it into practice your main focus on why you chose Regent, or how did that play out?
Super, really good question.
Thanks.
So yes, I think originally when I was looking at doctoral programs, I was thinking through a PhD program. But when I got to understand more about what a PsyD looked like, a PhD was redundant for me in a lot of ways, and that I had such a concentrated degree in experimental psychology already. And so I wouldn't necessarily grow in the same ways that somebody who came straight from undergrad or came with a clinical degree into a PhD program. And so for me, the PsyD program worked better in that it was super focused on kind of the clinical skills and that clinical training, and that I already had the underpinnings of my master's degree to kind of augment that, if you will.
Yeah.
So I don't feel like I'm missing anything. And for me, it was the right choice for sure.
That makes sense. Did you, being at Regent, they have a few different research groups. Did you find one that you really liked and just kind of honed in there? And did you do a lot of research while you went through the PsyD program? Or, we have kind of somewhat of a free roaming type choice where we can be really involved with research or kind of take a step back from it. So what was that like for you being here at Regent?
Yeah, Regent was really different. So, having been at a secular kind of state-funded university, research was a really big deal in our graduate programs. It was how we got funded. It was how people, didn't have to take out a lot of student loans, right? Like there is a big deal. And so it's a little bit just the structure of our PsyD program in that it's the medical model, and it's just slightly different. And we don't sit on people's grants as students the way that PhD programs do. And so that took a little shifting in my brain to kind of think about and wrap my head around. But ultimately it serves us well because we get flexibility, right? So like, when you're in a PhD program and you're attached to a person and their grant, like you're doing that work for better or worse, and hopefully it aligns. But here you get the opportunity to explore a little bit more. And so for me, when I was super excited about that, that was a plus in the Regent column for me. And so when I came to the program, I reached out to a couple of teams, and I was fully invested. And so I was on Hope starting in year one. And I also was with Dr. Yarhouse with ISSI starting in my first year and on that research team. And I stayed with both teams through my first and second year in the program. And then in my third year, I was offered the opportunity by Dr. Yarhouse to be his research associate. And so I came on to support ISSI in their research in a more formal role, which was wonderful for me, but also like my bandwidth was only so far, right? And so Dr. Ripley was so incredibly gracious with me. I was so nervous to meet with her and ask her, like, hey, can I pare down? Because, in third year of Hope, the requirements for third and fourth years goes up and you get more opportunities, and that's a wonderful experience, but I didn't have the bandwidth for that. And so she was really gracious in saying, like, if you need to make a decision, that's totally fine. And I was able to do that. And I highlight that to say that the faculty have been super supportive of our goals and our research along the way. And it wonderfully worked out for me, which I'm really grateful for. Yeah.
Well, that's good that I think a lot of us are in our first and second year, especially maybe the second year, you take on maybe more than you can handle. And there's even the proclivity to continue taking on that amount of work and just run yourself thin. So one, it's good on you that you had the insight and the self wherewithal to be able to ask, like, I can't sustain this and I need to focus my attention elsewhere for this. And so that's cool that it's good for you and it's good for the faculty that they allowed that and made room for that. So Dr. Yarhouse no longer being here, I'm not familiar with ISSI. Would you mind talking a little bit about that?
Institute for the Study of Sexual Identity. That's what it is. Institute for the Study of Sexual Identity. As the research team went along, because he had been doing that with Dr. Zaborzets from the counseling program, like they were chair and co-chair, director and co-director, assistant director throughout the time that I was there, for sure. And in the later years, but right before Dr. Yarhouse left, it also included gender identity. And so he not only had ISSI as a research team, which I'll explain that a little bit more in a minute, but he also had a specialty clinic in the PSC called SGI, which is Sexual and Gender Identity Clinic. And so we would see clients through the PSC that were presenting with concerns around sexual and gender identity and wanting to explore that alongside their faith identity as well. Which was a wonderful opportunity. We also did group therapy right in the room where you're sitting right now, actually, helping people navigate their faith identities and their sexual identities in a really meaningful way. So ISSI actually still exists. It is Dr. Zaporizets in the counseling department. Since Dr. Yarhouse left, has kind of like subsumed directorship of that. She's on my list of people to talk with today about perhaps kind of understanding where they are with their science right now, because I just don't know. But we did a number of studies through that team. So it was, in fact, a research-based team. Dr. Yarhouse and Dr. Zaporizets had colleagues and investigators that they would partner with across the country on different studies. A lot of them were qualitative in design, in part because the numbers of people for whom, they would meet the inclusion criteria of having, a faith background or a faith part of their integration aspect to who they were, and then also a sexual or gender minority status. And so finding people who kind of fit in that and are willing to engage in research it's a small N. And so, and a lot of it's new. There's not a lot of research out there, at least at the time when Dr. Yarhouse first started, for sure. And so we would do a lot of qualitative studies, and really, it's really rich data. But if you've ever done qualitative work, it can take a little bit of time. So there are some really wonderful studies that came out of that, really wonderful dissertations, mixed orientation marriage study that Joshua Matlack did. And so it was a really rich And it probably still is. I haven't talked to Dr. Zaporiz's yet, but my experience of being there was a really rich time of lots of opportunities for people to partner in the research process, but also support other people as they walked through their dissertations, right? And so there would be dissertation support along the way, which is also just invaluable. I benefited from that for sure.
Did you have kind of prior interest in that area of research and work, or was it something that was fueled by, oh, this sounds like an interesting research group, and then you kind of joined, saw what it was like, and then really liked it, and then progressed from there?
That's an interesting question. So in my master's work and my time at EVMS, a lot of my research focused on families and like paternal involvement and like parent education. And I did run parent education groups for about like 13 years, it was just a long time. So like family work was a lot of what my research had been in previously, some like, research in schools and things of that nature. But I think the idea of family was just interesting to me. And so when I was looking at the research that was available or like kind of established research groups, Dr. Ripley's kind of couples work was super interesting to me. And then also the idea of looking at the intersection of faith and sexual and gender identity felt so necessary to me. It felt like such important work. As you know, there are like interest meetings in the first part of the fall semester. And so I, went to all these interest meetings and it just felt like such relevant, important work. And I was impressed, if I can say that, by Dr. Yarhouse and his students that he had, who were really, they were authentic in their like desire to support people who perhaps didn't have a voice, and really helping create knowledge and science around things that people make assumptions about. And so for me, that felt like really important work. I don't know that it had even occurred to me that I would do sexual and gender identity work before I came to the program, although the LGBTQ community was obviously present and on my mind prior to that. And so I think it was kind of like this perfect storm of events that happened for me, and opportunities that happened. And absolutely believe that was divinely ordained. And so I will say yes to God anytime and walk that out. So
that's really cool. I think it was my first year, in Dr. Page's class, psychopathology. You and I don't remember his name. Who did
Dr.
you always
Furman,
do
Carson Furman.
Carson Furman. So you two came and did a presentation, and then you, I think it was a year later, we had another type of meeting, and you guys did another presentation. And I remember thinking like, wow, how cool is it that within the time that we're here at this program, I could potentially be kind of in her shoes, and I could know all of this about this specific topic and be able to give presentations. And you were already, in my mind, you were already considered kind of an expert in that area because you were so immersed in the literature and the research, and you were giving talks. And so I thought that's really cool to hear kind of your beginnings after I've seen where you are.
Where I was. Yeah. That's very kind of you to say, actually. And it's funny because Dr. Furman and I, it's funny that the timing of this, I say funny, it's ironic. So Wednesday this week, I gave the gender dysphoria lecture for Dr. Page's psychopathology class, which you remember. And then literally yesterday, the next day, Dr. Furman and I were invited to speak in team meeting again. So we gave a similar kind of talk, and we're doing it again next week. So I think the timing of this is really interesting.
Yeah, that's cool.
Remember that. It has been such a joy, personally and professionally, to be in the literature and to do something that I'm passionate about, and to have the opportunity to grow in that way, and then to do that like with my colleague has been a really wonderful opportunity as well. And I will say that a lot of Dr. Yarhouse, to his credit, was really intentional about giving us and inviting us into opportunities with him. And so he is a big name and did really big and is doing big and wonderful things,
Mhm.
and invited his students along for that, as much as we were able to do that. And I think that was just so significant in my own development to
Mm.
be able to shadow him and see how he does things. But then also it forced me to grow, right? Like I was then in a position where I had to know stuff, right? Like I was
Yeah.
already in the literature, but I was like, if I'm going to go teach somebody, I got to make sure I know what I'm talking about. And so these were just really great opportunities, and it propels us forward. And so Dr. Furman and I are still doing research on the side. We are kind of developing different materials moving forward. It's a really exciting time, actually. Yeah. So
Yeah.
I'm excited for you to have the same thing.
Thank you.
If this podcast was different, I would be asking you what those were. And if I can't ask that now, yeah, like what are the things you want to be interested in? Where do you want to grow?
Yeah. Yeah, no, those are important questions. And it's very much, it seems almost day by day, my thinking is reorienting or shifting. But it brings me to, I was, now that you're on the, let's see, on the outside of the student life, finally, where do you see yourself? So you've come back to Regent, you're in faculty. Maybe what is your faculty position, or what are your kind of ideas about working here at Regent? And then where do you see yourself going with either research, with practice as a licensed psychologist? What is your kind of future look like? Immediate future, you know?
Such great questions. And I will say it's funny to watch people kind of say that, right? Because it's like when you're on the other side or when you're outside, because it's like this kind of, you're in it and then you're out of it, but you're never really out of it, right? Although it is interesting to come back to the place where I was trained.
Yeah.
That is an interesting process. And I will say I have had such a wonderful kind of reentry
Oh, good.
process, if you will. Yeah, it's been so warm and so welcoming. I couldn't have asked for anything more. Honestly, it's again divinely kind of orchestrated.
Yeah.
I will say, so the contract that I'm on right now is a 1-year contract, and I've appreciated it for exactly what it is. It's a really great opportunity that presented itself. I couldn't have guessed that this is kind of where my first year out of grad school would take me. But I have always, again, identified as a scientist first. And when I was in the program, my very first year, clinical psychology was taught by Dr. Ripley, actually, at the time.
Okay.
And so I'll never forget one of the first lectures that we had. She asked, like, what do people want to do? Like, when you're done with this program in 5 years, where do you want to be? And I always said I imagine myself to be in an academic setting. I imagine myself to be either at a teaching hospital or a university. And I wanted all three. I wanted to be able to do research and teach and also have a clinical practice. And here I am today, getting to do all three.
Wow.
And it is a moment, I think it was last week, I was leaving the university and heading home. And I was like, oh my gosh, like I am now doing the thing that I've been wanting to do for forever. And so it's such a blessing, right? I'm excited. I can't stop smiling, right? Because it's just like it's such a great place to be. And I love hearing students talk about their dreams. I love having conversations with students that are really where they share their desires, because those are meaningful. Like you have those for a purpose. And so how do we help you walk those out? So this is a 1-year contract. I do have I'm working with a private practice on the side. And again, I'm still doing research independently and with Dr. Furman. And I've created some therapy materials that I really enjoy. While I was on internship, I had the opportunity to do that. And I'm so excited to not only use those, but then also do some science on them and publish that. And so I have some ideas about things I want to do. And if it's mutually beneficial, if it becomes appropriate and there's an opportunity for me to stay on at Regent at this point, I would be happy to do that. I thoroughly enjoy the students. Like that's what we're here for. We're here for you all. And that's my favorite part of my job, being here. But then also my colleagues are wonderful, and getting to be supported by such wonderful leadership is great too. And so selfishly, it's a really great place for me. And so as we kind of move through the year, we'll see where that goes. And if I get to stay here, great. But if
Yeah.
not, I want to have all three of those things kind of in my career, regardless of where I end up, for sure.
Yeah. Kind of wherever you go. Is the how many hours, like how many therapy hours a week do you generally have with the private practice on top of Regent?
Oh, that's a really good question. So, as a clinical psychologist, if you are working in an academic setting like full-time faculty or a
Uh-huh.
tenure track position,
Uh-huh.
especially for clinical people, they usually have like a day a week that, like, 8 to 10 hours
Uh-huh.
that would be toward research or clinical practice. And in lots of institutions, not just Regent, but in lots of institutions where they hire clinical folk, part of the reason to do that, to encourage that, is to keep your skills active, right? So if you're going to be teaching the next generation of clinicians, they want to make sure that you're kind of in the literature, learning and still growing and practicing well.
Yeah.
So roughly speaking, I have a day that I dedicate toward that, but
Okay.
of course, I
Uh-huh.
still, like, I'll have students pop in for supervision real quick,
Uh-huh.
and that's great. I'm happy to be on campus to do that. And so the private practice that I'm working with has allowed me to be able to be on campus and see my patients there, as opposed to being
Oh,
at
good.
an office somewhere. So yeah, it has worked out wonderfully well for me, to be kind of melding the two together in a way that doesn't feel overwhelming for me
Yeah.
personally.
Yeah. That's neat. That's good to hear. It's good. So one of the things I love about this is with even within the specific field of clinical psychology and the degree that we get here, there are so many avenues to take post. So it's very encouraging to hear stories like yours where you're doing the exact thing that you want to do and you're making it happen. And so that's good to hear about.
Mhm.
Um, how about, can I ask about a little bit about Wyoming? When you chose your internship site, was it a VA that you worked at there?
It was,
Okay.
yeah.
Is that what went into your decision? Yeah, to why Wyoming maybe, or why the VA? And how was your experience at the VA? I think VAs can sometimes get a bad reputation on the way that they're the bureaucracy within the VA. So
Sure,
maybe, yeah.
sure. Yeah, I'm happy to talk about that. It was an experience.
Mm.
So I'll kind of walk you through, and if you have follow-up questions, you just ask me if I
Okay.
if I don't
Okay.
get to something that you're super interested in. So
Okay.
um, for about I don't know, 12 years or so, I worked in government contracting as well. And so I had a lot of
Oh, cool.
exposure to the Navy specifically. The majority of my contracts when I worked in industry were with the Navy. And so I had a lot of exposure to military life. Obviously, living in this area, there are a lot of military people. And so it was kind of like a no-brainer for me to seek those opportunities when I was in my doctoral training. And
Uh-huh.
so for my fourth year practicum site, actually was placed at Portsmouth Naval Hospital,
Okay.
and working with active duty persons. That was a wonderful experience to me. I know the bureaucracy. I've sat in it, right? Like, I worked with it for a long time. And so it wasn't a new thing for me. It was par for the course, right? And
Yeah.
so learning to work within that system is like, you kind of figure out how it goes, and then you move your way through.
Uh-huh.
And so that was a really great opportunity. And I knew that when I was looking at internships that I wanted certain experiences.
Hmm.
And the VA seemed like the best fit for that, partly because I already had military experience, and knowing that I wanted to come back and be in this area, right? My
Uh-huh.
family is here. This is a meaningful, I have roots here. And so I knew I wanted to come back here, and the likelihood of me working with active duty and veteran persons was really high.
Hmm.
And so I wanted to get really good training around that. So that was one thing.
Okay.
Two is that I wanted to work in a hospital setting. I don't know why. It's always felt like a fit for me. I really enjoy interdisciplinary work,
Hmm.
working with other people who have wonderful skill sets that are totally different than mine, that we can all come together to benefit the patient. That feels like good,
Hmm.
work for me,
Yeah.
So I knew
Yeah.
I wanted to work in an interdisciplinary setting. Hospitals made a lot of sense to me. So I was looking at some inpatient hospitals, some state hospitals, partly also because I did not have inpatient training when I was in the doctor. So none of my
Okay.
practicum sites were at inpatient sites.
Uh-huh.
And for me,
Uh-huh.
when I saw myself as a psychologist, I did not want to graduate and be done with my training without having experienced inpatient or residential work.
Mhm.
So I was looking for something that had all of that wrapped up together, and the VA system was really the best fit for that. So I applied to, I think, all VAs. I think I had a couple, I may have had, 2 or 3 state hospitals in there too. But it was really all VAs, and I'm okay. Like, again, I understood the bureaucracy for what it was. And so I kind of had that mindset, but I also knew that the VAs were well structured for internship training. It wasn't actually until I got to my internship site that they said, I think they said it was the 75th anniversary
Oh,
of VAs training psychologists, clinical
oh, cool.
psychologists. And so they gave us a little history about it. There was like this nationwide VA thing where all of us who were at VAs got to be, kind of on this call together. It was really great. And then you realize how much money and time and effort the US government has put into clinical psychology training for its veterans, and the majority, so the place that employs the most psychologists in the nation is the VA system.
Oh,
And so each one is different, right? They're all slightly different, but they all do follow a very similar kind of format. So
yeah.
I was looking for places that had a lot of different opportunities within that particular hospital, but I specifically wanted to also make sure that they had inpatient training as well. Okay. All of that said, I went up and down the East Coast because that's what I'm really familiar with. I'd never been to Wyoming or that part of the country in my life. But I also knew that I didn't have rural training. And so I was like, if I'm going to be a generalist psychologist, I need to be as well-rounded as I possibly can and do all the things that I could possibly do in training before I become a psychologist. So they are frontier. They are out there. When we talk about rural, like there is nothing for hours. Like I learned to take supplies with me when I would just like go for a 45-minute drive because there's nothing out there. So when I matched when I matched with Wyoming, I'm not gonna lie, I was a little surprised. I was surprised. And then COVID hit. And so interestingly enough, this is just a tidbit of information for you. Because Wyoming is so rural, they did not, this one site did not require, they didn't even have in-person interviews. They didn't have them. They only did phone interviews. So they didn't even do Skype or like Zoom. They did phone interviews, and everybody like sat in the room and they would ask questions on the phone. And so I was like, oh crap, of course this is the one that I match with because I've never seen these people. And how else is the Lord going to teach me trust? And I just don't know anything. So I was like, okay. Match on match day, and I immediately booked flights to like go visit the town and try to find housing and all that stuff and meet these people. And then COVID hit, and then our travel got canceled and all that stuff. And so I did not know anything about this other than what I could find on the internet until I literally drove into town. So I drove all the way across country, packed as much crap in my car as I could, and drove across this country to get there. And then showed up, and I was like, okay, this is where I live. And so it was like, I don't like doing things blind, Daniel. I really don't. I like to think. I like to make good decisions. So it was an exercise for sure. But I will just say that VA is legit. I had all the experiences I could ever want to have while I was there. They were so supportive. They were like, oh, you want to do this? Great. Oh, you want this kind of client? Great. Like, and the psychologists there were superb. They were, if I was going to learn, like in my last year, if I was going to spend time with a bunch of psychologists, these are the ones. If I could have picked them, like just designed them, it would be these people. They were phenomenal. And I am still in contact with them. And I hope to visit them and work with them in the future, like do publications. Like I professionally want these people and personally want these people in my life. So the Lord knew what he was doing, right? So it's not what I would have chosen, I think, as my number one, but it definitely was a wonderful experience. And I'm all the better for it, for sure.
That's also, that's also very encouraging to hear. And it's, I appreciate you sharing your experience. That's really fun. And just thinking about you going across country in this little town in Wyoming and that you've never been to before. And maybe it wasn't your first pick, but hearing you on the latter side of it, saying that it was everything that you could have asked for if you had known you wanted that. What was so you mentioned, the rural population, and you've grown up your whole life on the East Coast. What
Mhm.
was the demographic of clientele like there? Was it a stark difference? Did you expect more of a difference, or was it more like, oh, these people are the same? Yeah, what was it like that?
Different. It was
Mm.
different.
Uh-huh.
So I will say, even in just this area, right, like
Uh-huh.
where we are in southeastern Virginia, there's a level of diversity that is just normative,
Uh-huh.
right?
Yeah.
So racial diversity, ethnic diversity, aged, like generational, like everything.
Uh-huh.
And so I just kind of have this norm in my head about that. And so when we arrived to Wyoming,
Uh-huh.
um, I did as much as I could to understand the demographics a little bit before I got out there,
Uh-huh.
realizing that indigenous peoples is a significant part. So the internship site actually did a wonderful job, because they knew that they were getting, they know that they're getting people from kind of urban areas or from the coast.
Yeah.
And so they structure those first 2 weeks of training with us really well. And the first lecture we have is about frontier and rural psychology and what it's
Oh,
like to
wow.
work in a place like this, right? And so
Yeah.
beyond like dual roles and that kind of stuff, because
Uh-huh.
that is going to show up like it just does,
Uh-huh.
but also like the mind frame of people who are from that area and what it is like to interact with people who are so incredibly independent because they have to be.
Mm.
When you ask about risk and suicidal ideation, and you're trying
Mm.
to assess for that, and then also put together a safety plan. When you ask about firearms, it is
Mm.
not uncommon for them to be like, I don't know how many I have. Last time I
Uh-huh.
counted, it was 50. I'm not kidding. I like, because they see them as tools, like a
Yeah.
hammer. And
Yeah.
so wrapping like your head around that was just, there's some training just about how they think about the land, how they think about each other.
Mm.
Um, so that was actually the biggest part for me, was to like try to get into the mind frame of what it's like to live in that area
Uh-huh.
and grow up in that space. And then also just, there's not a lot of racial diversity. It's a lot of white people.
Mhm.
Um, and then people who live there, since there are not a lot of natural resources, they choose to live there and they forge a life out of
Mm.
the really harsh conditions. I mean, I experience, this is a small thing, but I experience 100-degree range in temperatures. So it was negative 30 one day, and then in the summer I remember it being up like 120 degrees. So it's like
Wow.
this, like so people who can survive in that,
Uh-huh.
they're hardy and they have a different kind of mindset about what they're doing when they're out there. And so,
Mhm.
and then to also learn the history of indigenous people and what, um, that whole piece of history, right? And
Mm.
the implications of that and the ripples through time. And so, there were some indigenous people that would come through the VA who were veterans,
Mhm.
and reconciling kind of these identities that they have within themselves,
Mm.
was super interesting. Wyoming specifically is different than some of the states around it, in that they were the first to rectify, uh, ratify laws about women being able to vote. They were the first state
Oh,
to
cool.
sign that and allow for women to vote.
Wow.
So in some ways they feel really progressive, right? So the
Uh-huh.
Matthew Shepard situation happened there. They were the first to put really good laws and protections for LGBTQ people, but
Uh-huh.
in some ways it's pretty progressive in that way. In some ways it feels really conservative. I mean, it is a
Mm.
conservative state. They tend to vote very conservatively. And so the dichotomy there was interesting to navigate too. It was a lot. It was a lot to learn. It was an
Yeah,
interesting place.
that
Yeah.
sounds super fascinating. Good
Yep.
experience, right?
Yeah, it really was. I
Yeah.
did a lot of hiking. It was great. Saw a
Oh,
lot of
good.
bison. Yeah.
Did you ride any horses?
Oh gosh, no. I'm that's not my jam.
One of the last questions I had is um well, it's kind of a twofold question.
Mhm.
So one, who either whether they're currently in the field or they were prior, who has been very influential for you in the field of psychology? And then two, if you could recommend maybe a book or an author, who would
Mm.
you recommend?
I'm gonna have to think on the second one for a minute, because I have
Okay.
so many
Yeah.
that I love. So to answer the first part of your question, Genuinely,
Uh-huh.
the people who have most influenced me in this field have been my mentors and supervisors. And
Mm.
I, I don't know if that's not like the answer you maybe like
No,
people
yeah.
want. Is like this fancy answer because
You're
it's
good.
not like Zimbardo. It's not, you know what I mean? It's not like
Uh-huh.
Stephen Hayes. The people who really influenced me are the people who invested time in me and
Mm.
who were willing to share of themselves and
Mm.
to be an example for me, and the people that welcomed me to kind of bear witness to the way that they work and to
Mm.
learn from that. So very specifically, obviously, Dr. Yarhouse is one of those. Dr. Page is a
Uh-huh.
significant one of those for sure. Dr. Stevens, like all the people that I work with, people that I worked with at EVMS, I still follow them. We still stay in contact there. I still seek them out for counsel. And when I'm making decisions, right, like career decisions and things. And I have found that people in this field are so like more than happy to reach back and
Yeah.
to share their wisdoms. And to me, that's invaluable. It
Yeah.
is one of the reasons why, like, I couldn't imagine being in this field without staying connected to students, right? To
Mm.
be able to like, as if I have any wisdom, if I can support them in any way, like that's my hope, right? Because so much was poured into me. I can't imagine not turning around and pouring it into someone else. And so it's really those people that were closest to me and
Mm.
who took the time to talk with me and teach me. And so really everybody and my peers now, and they're my peers now, which is just like,
Yeah.
it's mind blowing. Yeah. So books, because of the work that I do, and I don't say this because he was also my mentor, but Dr. Yarhouse's books are
Mm.
some of the ones that I return to again and again.
Mm.
I return to them for myself, and I return to them when it's time for me to provide resources to other peers,
Uh-huh.
and to people who are navigating the process. He has a wealth of publications out there for clinicians specifically,
Mm.
for pastors, and for lay people who are, trying to understand and grapple with different concepts. And so I return to those again and again.
Mm.
There are some other authors. Wesley Hill is a theologian
Okay.
who identifies, he's a celibate gay Christian.
Oh.
And so his attraction is toward men, but he's chosen a celibate lifestyle. And it's not just celibacy.
Uh-huh.
He seeks community and deep relationship with, intentional relationship with families that he is then connected with. Like he is part of their family. They do not make decisions without him.
Mm.
Like,
Wow.
so there are these really beautiful ways of living, and people who have done such deep and thoughtful work in the area of faith and sexual and gender identity. And I soak in that because it is an opportunity. So much of kind of like society and life just moves really quickly.
Uh-huh.
And in graduate school, I so appreciated the opportunity to kind of just think, right?
Mm-hmm.
Like to digest information and to think and to grow and to deepen. And there are people out there who are continuing work like that. And so when I read those authors, I then get to sit and think and grow and deepen. And that's the kind of stuff that I think allows us to be effective for the long haul, right?
Yeah.
Because it doesn't stop when you graduate. You just keep growing and learning. Yeah.
That was very well put.
Thank you.
Yeah. Okay, Dr. Keefe, thank you very much. This has been very fun, and it's been informative. I've enjoyed talking with you, and I hope that I'm sure everyone will enjoy listening. So.
Oh my gosh, Daniel, this is wonderful. What a great opportunity. Thank you. I'm not going to lie. I kind of want to stop and be like, so Daniel, like, let's do this in reverse. Like, tell me all the things, right?
Maybe we can do a follow-up.
Another time. Yeah, please do. That would be great.
All right, Dr. Keefe, thank you so much.
Absolutely. Thank you.